Choosing Wisely campaign actually has done a great deal to raise the awareness of the importance of the role of laboratory medicine in terms of healthcare in the medical community and in the public community as well. I think one of the things that will come of this, and already has to some extent, is the increased request for professional consultation from pathologists and laboratory professionals about effective utilization of laboratory testing, not just the ones that are on the Choosing Wisely list, but really engagement in general about better use of diagnostic services.
You know, another success that we've had with Choosing Wisely has been the engagement of our own laboratory staff. Our medical laboratory scientists, our cytologists, our histologists, our technologists have really gotten excited about this program. And now I find them coming to me. They have ideas on tests that they see being ordered inappropriately, tests that are either duplicates or they're probably misunderstood by the physician. And I find that they're calling up the physician to clarify the test order with them so that we're sure that we get the right test for the right patient at the right time.
First thing I would say is get, understand and get comfortable with the Choosing Wisely recommendations.
Mm-hmm.
And those are 10 easy steps that I think, there's good data behind, all of these recommendations.
Mm-hmm.
There's exceptions to all of them, but they would be able to get rid of 80% of your inappropriate testing if you implemented them well. On the other hand, you can look at the very, very high cost, say molecular tests and exomes, and really make sure that you're utilizing those very wisely and very appropriately, because one of those, if you could not do it, pays for a lot of common tests.
The first recommendations that we implemented was had to do with vitamin D screening for population health, ordering vitamin D tests for patients without indications for vitamin D tests. And we found a relatively good acceptance rate of the physicians to an alert sharing with them the information that vitamin D tests for population health screening may not be appropriate. And so we looked at canceled orders, and we also looked at the decreased rate of ordering vitamin D tests per 1,000 patients, and we found a savings annualized in the first year of over $400,000 from just an alert hardwired into our electronic health record with that single recommendation alone.
I think a laboratory in its ultimate state of testing and communication, we need very closely, and we are, as a part of this matrix, work with other medical professionals, nursing being one, medicine, physician, or whatever the subspecialty that requires our input, because we should never forget that approximately 70% of physician decisions is based on a laboratory outcome. Our product in the laboratory is to generate results that are accurate and timely. And if we cannot keep track of timely and accurate, then we're out of business. What's the point there?
So, the Choose Wisely program really helps us to be able to enter into the education role that we as pathologists have an important role in doing. I think often we get caught up in the day-to-day, just running the lab and making sure things are running smoothly, and we sort of lose that educational role that we have as pathologists. So the Choose Wisely program helps us get back to how we can communicate and educate our clinicians and the medical staff. So we do that, for us, we do that with the newsletter was the first step, is taking each one of those steps and talking about it in the newsletter. Not just listing out the steps, but saying what we have done with those steps and how we've applied. And it's a chance for us to say, hey, look what we've done already. These things have come forward, and we've been doing this for years. And then there's areas that we've been able to identify that we need an improvement for, or need to make additional steps with. And so it's that general educational role has been very helpful. And then also for us to be able to go and talk to individual clinicians, to be able to help them understand how we as a lab can help them in their practice.
There's several challenges that we face. One is occasionally we'll encounter a clinician or a laboratorian who is not supportive of a particular recommendation because their practice is different. That's why we made particular emphasis to engage our experts to make sure that our recommendations were supported by the literature, that the literature then suggested a particular direction, and we went with that. So I think that there's always going to be some people who don't agree with any particular recommendation, but by and large, we've found that in fact, most of the individuals that we've encountered have in fact not only supported the recommendations, but actually welcomed them because it would help them drive practice change in their institutions.
First of all, it's human nature that if you've been practicing a certain way and not encountered any problems, you're comfortable with that and you don't want any changes.
Right.
Cardiac surgeons can be very resistant to change, for example, because they're dealing with critically ill patients and they don't want anything to go wrong.
Right.
You talk with them, you reassure them, you show them evidence in the literature, you show them other programs where they've done it. The best way to get a conscientious clinician to change his or her practice is to gently let them know that some of their colleagues have done a better job, and that will generally motivate somebody to do a good job, a better job for themselves, because they want to keep up. We, as doctors, we all took an oath to serve patients, and we want to provide the best care we can.
One of the first challenges that we faced was with data collection. We knew that the data would be so important that we really had to have robust data if we were going to use that to change physicians' ordering practices. And so we decided that we needed to tackle about a year's worth of inpatient laboratory test orders, that we needed the specialty of the physician ordering that test as well as the subspecialty of that physician, and that we needed the diagnosis of the patient. And that was a lot of data, and we discovered early on that we would need to involve a consulting company that would help us gather that data and to analyze it for us. And the second challenge was around engaging the right physicians. We knew we needed a core team of physicians that would be part of our test utilization committee, and that those physicians would help us to analyze that data, to look at that data and create the policies. Things like, are there tests that are only going to be allowed to be ordered once a day? Are there some tests that might require pathologist approval before ordering? Maybe some tests that only a specialist could order, or maybe other tests that we're just not going to be allowed to be ordered in our facility. And we also knew that those physicians, that core team that would be our committee, would be the individuals that take this test utilization plan out to other physicians and engage them and get their buy-in to these new policies and procedures that we set in place.
I would say the technology has actually hampered us with the opening of our electronic health record. We found that most of the ordering is done electronically now, and we have very little capabilities to control that. For instance, in the past, we had a policy that you could not order inpatient lab tests for more than 24 hours in the future. You couldn't order daily labs. We recognized that that was one of the things that really made utilization go crazy, was to do the same test over and over and over again for days. With the institution of our EHR, there is no prohibition against ordering that. I have seen clinicians order 9,999 instances of a test just because they didn't want to ever think about it again. That's completely the opposite direction that we want to go in. So I think the technology is there that helps us on the electronic orders, but hinders us on our ability to then control utilization.
The procedure outlines what the laboratory thinks should be ordered for specific procedures or specific comorbidities, and then the ordering physician has a choice of what they want to do. And so they know what we think that they should do. They always have the choice to either go with that recommendation or not go with that recommendation. But I think it's a step forward for the lab to be able to say, this is what we think, and this is our input, instead of just saying, let's get everything.
Right.
So I think we need to constantly also listen to the needs of our customers, who is our audience. Ultimately, it is a patient, but we have physicians, we have nurse practitioners who use our services, we have nurses, and one of the very important strategies in that matrix of change and creating these new algorithms of treatments for a better outcome is the laboratory medicine component and its relationships with nurses, with nursing staff, and with physicians of other disciplines.
I think it's the need to engage, to involve yourself, to be an educational vehicle for the role of laboratory medicine. As I said before, people are, we're all overwhelmed with the amount of stuff we have to do. Whether you're a physician or not a physician, we're all overwhelmed because of the volume of information. So you need to take the time. If it's not everybody in the group that can engage in this, pick someone within the group who's kind of the leader in this effort that can interface directly with the hospital medical staff and start bringing these issues to the table for discussion. So I think you need to engage, involve yourself, and be part of the educational mission.
Those of us who've been practicing pathology and laboratory medicine for a number of years realize how much we do directly impact patient care. The diagnostics that we provide actually drive a huge number of the clinical decisions that are made. I think one of the wonderful things that has resulted from the collaborative nature of the Choosing Wisely campaign, and really the inspiration was provided by the American Board of Internal Medicine, was that it actually allowed a lot of us to come to the table and to be part of that discussion. And I think as a result of that, we've been able to really interact with clinical colleagues to a greater degree. Obviously, many of us are doing that and have been doing that all along, but really I think it helped raise the awareness of the importance of laboratory medicine and effective use of clinical laboratory tests going forward.
We really value the relationship with the ASCP. I think it's been productive for both organizations. We're working on some legislation this year in conjunction with the ASCP regarding cytotechnologist scope of practice. So the collaboration has been wonderful. You have great resources and tools. Our society is really relatively small budget-wise and membership-wise. So being able to have a national organization with ASCP's reputation and capabilities has been very valuable to the society.
As a laboratory professional, I think my role in the Choosing Wisely campaign at my own facility has been to get the ball rolling, to raise the awareness of senior leadership and get their buy-in, to get the development of our test utilization program going, to begin to get our leaders, like our chief medical officer, to help me engage physicians in this process, to begin the work of that test utilization committee, and to make sure that we have the data that we need to make the changes that are necessary.
In fact, I feel that the pathologist plays a special role in that we care for many, many patients that we will never see. But our involvement and work behind the scenes in managing laboratories, assuring quality of patient testing, and assuring that physicians who utilize our services understand the best tests to order to improve diagnosis and treatment for their patients. So while we may not interface directly with individual patients on a daily basis, the work we do improves and assures the quality of care for all patients.